helpful.
Yeah,
Too.
I was just printing off Ken's PowerPoint because I know I want that one. I'm gonna actually, before we start, I'm gonna go check my printer and make sure I had enough paper.
Yeah.
I'll be right back.
Okay. So that's a great announcement, though. For those of you, if you did not join Dr. Ken Adams on Overcoming Enmeshment, his PowerPoints are in the blue band at the top. You can download those. And then Deborah Kaplan's on money and financial issues and recovery and power relationships with money and in relationships. That's the Money Mistress and Financial Affairs. You can download that one as well. And she had a lot of information she was not able to cover due to time, including an exercise that she was hoping to get to. So I would invite you to download that one. If you're joining this one, The Power of Ambiguous and Original Grief is up on the blue band. You can download that now and have that handy and follow along the slides as Sophia is going through the material. For those of you joining, this is recorded, so I'm going to ask you to IM questions to me, and then I will ask Sophia them after she completes her presentation. Please do not request to share. I'm going to X you out. This is recorded, so we don't want people on the on the recording. We want to preserve your anonymity and just keep it clean. So if you just IM me your questions, I'll make sure that we ask them. I try to ask them in order. Sometimes a couple people are asking a similar thing, so I can kind of pair them, but otherwise they're typically asked in order. So we're going to get started in about 4 more minutes.
And do we have a hard stop at 6?
I've been trying to hold the boundaries, so yeah, we've been trying to, to stop. We can see where we're at, but yeah, we try to do that. So I have been sending people your way. I get lots of requests at Seeking Integrity for referrals, and anytime which is often, I'm hearing some grief issues, I send them to your In the Rooms groups, but also to your website. Are you still able to you're doing the workshops yet, right?
Yeah, I'm actually I'm doing intensives with people in person.
Oh,
and so,
okay.
But that's only like after I'm making sure that they're quarantining for 2 weeks before, because I'm not going out and doing anything. And so I just make sure that that's safe. But yeah, I do grief intensives, original grief intensives. And I also do, and that's for addicts, partners, and couples. But then I also am doing some couples work, Haiti Schleifer's work of encounter-centered couples therapy, which is extremely, it's neuroscience research based, and it's very connecting research. It's really wonderful for addicts and partners.
Great.
Yeah, so definitely I appreciate the referrals, and all of my clients are doing the podcasts and everything on your website. So everybody loves it. I've had several clients tell me, you really need to get to know Rob. He could really help you out. And
you're like, I know him, and like, I've done a podcast with him. So that is so funny. Yes.
It is really funny.
And you just say, great idea. I'm going to look into that. So.
I'll try to get in touch with that guy. I like him. Yeah.
Well, like I said, I get asked by people are always looking. And right now there's, the misinformation that you can have a therapist anywhere because of COVID, and you can just do it all online. And I'm like, no, they still have to work within their state licensure. So I'm always discerning who's there, but with workshops or a private intensive like that, that's really helpful to know. So
yeah, and I'm doing grief workshops for sure. And ITR clients get a really huge, major discount. It's like the whole workshop for like 1 hour of my fee, which is nice.
Oh my gosh. Are you people listening? That I hope the recording is going. That's great. So
yeah.
Well, and so to remind us, as we're still yakking, I know you're still doing 2 groups on In the Rooms, correct?
Yes. Yeah, I'll talk about that. I do the coronavirus support meeting, which is so funny because I thought that was like going to be a 6 or 8 week stint.
We all hope that. Yeah.
And then the codependency, grief, and relationships meeting. But grief comes up in both of those meetings. So it kind of, it's hope some people will already know what this is if they're my regular crowd, but if there's new people, and I hope there are, I'm not noticing. I mean, there's a lot of new faces down here that I don't know, so I'm really happy about that.
Me too. I love it when we have, I mean, yeah, the point of all of these, and the reason Dr. Rob, you know, he had the idea of bringing this to In the Rooms, because he's like, you know, we know all these people, and so often the professionals are talking to other professionals, which is great. It's really important, but to have people who are just looking to learn more in their recovery, and have support, have the information and the ability to ask questions, I think is very meaningful. So, you know, I love being part of this, and it's time, Sophia. So I'm gonna let you introduce yourself, and let me make one more announcement. So for those of you that are just joining us, we're thrilled you're here. If this is your first Super Saturday Recovery Summit on In the Rooms, welcome. This is different than the typical In the Rooms meeting. So for those of you joining, we ask that you not go to the request to share. If you've got questions for Sophia, you can IM them to me. We thank In the Rooms. They've been doing this. I got accurate information. They've been doing this for 12 years on this platform, and you know, we're really way ahead of the whole thing, you know. And then coronavirus hit, and everybody needs these kind of resources. But they've been doing this and connecting people around the world for 12 years. So visionaries, fantastic. We love collaborating with them. I mentioned to those of you that were on earlier that Sophia was part of the April group that did the Super Saturday Recovery Summit, and unfortunately the recordings didn't take. So we're thrilled she's back and able to talk about the PowerPoint is The Power of Ambiguous and Original Grief. You can download that and follow along. So I'm going to mute, and I'm going to let you get started, Sophia. I'm thrilled to have you here.
Thanks, Tammy. And I just want to make sure we're recording. Yes. Okay, good. All right, great. Yeah, I just wanted to be sure before we got into too much content. So hi, everybody. I'm Sophia Caudle. Welcome to The Power of Ambiguous and Original Grief. This is going to be hopefully a uplifting and hopeful and empowering presentation for you about grief. I find that grief work can actually be empowering, which is sort of the opposite of what we think about grief work being. You know, typically we think about grief work being very hard. It is very difficult at times, and sort of like hard and difficult and painful is really just the path of grief work. And we also sort of think about it in terms of death and dying. And just a little bit about me, my path and my work of being a psychotherapist and a grateful woman in recovery. So incidentally, let me say, hi, I'm Sophia, grateful woman in ACA, SAA, Al-Anon, and CODA. So that's the other way that I can introduce myself. But I'm also a therapist in North Carolina. And just to be clear, this is not therapy. So this is not a therapy session. This is just a presentation, certainly using my experience in my professional work. I do grief research. I've been doing that now for about 4 years, and maybe 4 or 5 years. And so this is really just going to be hopefully a helpful presentation to help your work and your recovery and whatever it is that you're working with, but help you connect some of the dots with whatever work there might be left to do. And grief work, I find, tends to be that foundational work that is underneath all of the trauma, all of the addiction, all of the depression, anxiety, bipolar, whatever diagnosis you want to throw out there. Grief work is really at the very bottom of that. And most therapists, in my experience, don't do grief work. And really, as therapists, we have to have done our own work in the certain area before we can give it to someone and lead someone down that path or partner with them in that path. So this grief work that I'm talking about today, and this is really just going to be a brief overview, is work that I have done and am doing personally, and will be doing the rest of my life. So much like addiction, and addiction recovery, grief work is something that we do the rest of our life. After we get sort of a handle on what our original grief is, and that's slightly different for everybody. After we get a handle on what that is, the work as it comes up, it just sort of tends to be much the same, and we know how to care for ourselves when grief kind of bubbles up. So, oops, hold on, there we go. Okay, my email just popped up and I couldn't see anything. So that's just a little brief overview, but let me just also chat for a few minutes and let you know what I do, my areas of focus as a therapist. So yes, I do grief research and writing. I'm writing a book about grief right now, but I also specialize in sex addiction, sex therapy, intimacy, recovery, all relationship issues, as well as codependency, enmeshment, and just, again, anything related to relationships, and also Rob's codependency, because that's a nice, I find that codependency and codependency actually work quite nicely together. There's a time for both, and that really is each individual client's decision on where they are in that recovery, and I like to honor all parts of where someone might be. So that's just a little bit about me. Again, I have I have 3 practices in North Carolina, and now I'm all over North Carolina because of COVID. So if you're interested in reading a little bit about like a couple of grief blogs, I also have a podcast called Sex in the Bull City. Check out my website. It's Bull City Psychotherapy, which you can see the little logo down there. And also, I will talk about this at the end. I do a couple of meetings here on In the Rooms. Mondays at 3 p.m. Eastern, I facilitate the coronavirus support meeting. And every Thursday at noon Eastern, I facilitate the codependency, grief, and relationships meeting. So we talk a lot about grief in that meeting, but actually grief for sure comes up in the coronavirus support meeting. There's actually an article that I just was able to have ITR very nicely publish on Wednesday in that Wednesday bulletin. It's called Grief and the COVID-19 Pandemic, I think is what the article is called. And so please check that out. That's got a lot of interesting information in it, just sort of all the different ways to think about grief and see how it's working in your life so that you can start cultivating these tools for managing grief, because grief does bubble up frequently for people when we get triggered, and it's definitely going to affect addiction recovery. So a lot of times when our grief is bubbling up, we're actually not aware of it, and then it's going to affect different things in our life, again, addiction recovery being one of them. So I'm going to go ahead and get started. Just want to reiterate what Tammy said, that she was reminding everyone to, and I actually have the PowerPoint pulled up, and so I can't even see the Brady box, but we prefer that you not come in the Brady box. And if you have a question, feel free to instant message Tammy, and she will read questions out loud to me. I would say I'm actually fine if you want to message me, but that might be a little confusing, and so maybe Tammy would be better to just let her know, and then we'll definitely get to your questions. If we're not able to get to every question, please message me through the website. I'm on here frequently in meetings myself, and so feel free to reach out to me, or preferably attend the meetings on Monday and Thursday, and then you can ask me directly. And people love to watch us have conversations. So if someone's in the box and we're having a conversation, I always hear from like 10 or 15 people, that was really helpful, I had the same question. And so we can also have a conversation in the meetings that I facilitate, because I don't facilitate traditional 12-step meetings. I love 12-step meetings, but my meetings happen to be open discussion. And so we can have a conversation, ask questions, get feedback, that kind of thing. So hopefully I'll see you there. So I'm going to go ahead and get started. My presentation, I don't think it's going to last that long, which is, hopefully okay. I can talk a lot about grief, and so if you have questions, just shoot them Tammy's way, and I'll be happy to elaborate. And I'll try to elaborate a little bit here in the presentation, but I want to make sure that everybody has time to ask questions, and we can kind of hopefully make sure we're getting to all of everybody's concerns or questions. So the power of ambiguous and original grief. And I'm actually looking at my presentation. If you see my eyes kind of look away, that's what I'm looking at. I have it pulled up here. So just at the beginning, why are we even talking about grief? Grief is kind of a bummer. And so, again, nobody comes running into my office saying, I really want to dive into my grief work. It's really hard, and it can be really painful at the beginning. It's kind of like, I feel like, very similar to addiction recovery. Addiction recovery is really hard and really painful at the beginning. And then it's sort of like, once we develop tools and we have a support network, then we're sort of in a groove, and we know what to do when triggers come up. And so grief work is, I think, very similar to that. I also believe it's important to be able to understand different types of grief so that we can move through grief rather than being stuck in grief. And I'm going to talk about the types of grief that I really research and write about are ambiguous grief and original grief. And I'm going to talk about that in a minute. But there's another type of grief that sort of we all know about, which I call traditional grief, and that's death and dying. So there's other types of grief, like there's anticipatory grief, which is specific to anticipating the death of someone. And then there's disenfranchised grief, which is the grief over losses that are not socially accepted, like maybe divorce. That's actually all in here in ambiguous grief. So that's why I don't talk about those a lot, because it's all included in ambiguous grief. So again, as I stated a couple of seconds ago, grief is really that very final bottom foundational emotion to address after trauma, anxiety, depression, addiction, everything you can think of. After that has all been identified and worked through, we get to the grief work. Hold on one second. So until a person has grief awareness and their specific grief is understood, grief will keep getting triggered, and this will cause potential problems for recovery, sobriety, really anything else. But I'm just, staying specific to recovery here. But it's going to affect our feelings and behavior in relationships. It's going to affect everything in our life when our grief bubbles up. And again, most people, we're just not even aware when our grief is bubbling up. It's just not something that grief is not a sexy thing to really be, providing services for, or, getting into. It's really, not. And that's because of the association with death and dying. But hopefully after this presentation, you'll have a different opinion, because there's a lot of, there are so many dots to connect. And there's so much empowerment when getting into this original grief work. It's really quite amazing. I've had only positive feedback from people who have come and done this work from me, with me, either clients or people from around the country. So ambiguous grief is the grief experienced from the loss of a loved one who is still alive, accompanied by a change or death of the relationship. So that is the definition that is copyrighted with the U.S. government and Patent Office. And so that happened in 2018. And since 2018, I've expanded original grief to include awareness of what we never had. So a child, a loving partner, financial security. These are all examples of something that we never had that we would be aware of. Like, oh, I was never in a relationship that I could conceive a child. I always wanted to have children. Or, you know what? I've never had financial security my whole life. I grew up poor. I'm still poor. I mean, this is really, it's been horrible. So those are the things that's like, oh, I wish I had had this life experience. Then when I was doing this work, I also realized that I was trying to categorize what are the main areas of ambiguous grief. They all started with a D. And so I just named these the 5 big Ds, and they are divorce. So that is sort of one type of end of a relationship. And divorce, we could talk about divorce with all types of relationships, just like splits. Disclosure, diagnosis, death of a relationship, so something's totally ended, and disappointment. So sometimes relationships, they take different paths. They might change. Maybe there's two best friends and they used to be really, really close and have a very close, intimate relationship, and now they're just sort of friends. And so that's really more of a divorce. There's not a death of the relationship. So they're still on speaking terms, but it's just different. So there's lots of different ways that that's going to show up in relationships. On our next slide, so here's some examples of ambiguous grief. Betrayal, so affairs, cheating and lying. That would be, a partner, for instance, in the work of sex addiction, finding out that their partner is a sex addict and there's betrayal trauma involved there, and lots of lying, and basically a completely second life is how that's really felt. And that's how the partner really thinks and feels, like there's this whole other person, whole other life. And it's just, it's really a very, very much grief. And so with partners of sex addicts, this is actually where this work originated from. I found that once the trauma was processed, that person doesn't carry the PTSD diagnosis. I mean, it's not correct, and it's not professional, it's not ethical to tell someone, oh, well, you have PTSD like their whole life. That's crazy. And so what I found with my clients was teaching them about ambiguous grief was quite empowering for them, because they were able to really understand, oh, I'm not feeling so disturbed when I think about this, but I'm still really sad and definitely feeling grief. And this husband who I had is changed for me. Our relationship is changed forever. And who I thought he was is not who he really is. And so putting this through the lens of ambiguous grief was empowering, because there's a different understanding. Instead of just telling someone, oh, well, you're traumatized, that's sort of like a dead end. And grief, when we talk about grief, one reason why it's empowering is because there's the implication that grief is something we can move through, and it is. And there's the light at the end of the tunnel. And so that's how grief is. We're just moving. We're constantly processing our grief, moving through grief. And it's just a very different way to view yourself with how you feel in your work, as opposed to something like trauma, which trauma does apply in lots of areas. But specifically, what I was talking about with this was after someone's trauma is processed, they're sort of feeling better, and their numbers are down. They don't carry that diagnosis anymore, but partners were still getting upset. And so we think about that in terms of ambiguous grief, and that made sense for them. Mental illness, addiction, Alzheimer's, ALS, Parkinson's, separation, divorce, disappointments, awareness of what we never had or what we lost. Again, these are all examples of ambiguous grief. So a little bit more about ambiguous grief. So oftentimes, and I'm not sure if you have your PowerPoints up, but that might be helpful if you pull it up. You can actually hear me while you look at this, or you can just look at me. Either way is fine. Oftentimes we stop our 12-step or psychotherapeutic work after we feel better, after trauma and other more obvious emotions are reduced, and ambiguous grief, as well as other kinds of grief, are beneath those emotions. And since they are quietly lying dormant, we may not even know that grief is an emotion to work through until it pops up, or unless we realize we are stuck in grief, which is called complicated grief. I'm just going to pause that so I can cough. All right, thank you. So with ambiguous grief, we can get stuck in the cycle of hope, because we're hoping for the person to return or the relationship to be restored. So rather than be stuck, we consciously learn to put hope in ourselves and our own recovery, which helps us in our grief work to move forward. So this is actually a huge component of what is copyrighted, is there's a whole cycle of hope. I didn't put that slide in here because it was kind of just getting into stuff too much. But basically, the cycle of hope is about staying focused on ourselves instead of looking at the other person out here and going, oh gosh, I hope he comes back to me, or oh gosh, I hope our relationship turns back like it used to be. I hope things get better like they used to be. So you can sort of hear somebody like looking into the past, looking behind them, looking outside of oneself, putting hope in someone else's work, putting hope in someone else's thoughts and feelings and behaviors. That's a pretty anxiety-provoking place to be. And that's also going to continue someone being stuck in grief, because we have no power or control over what someone else is doing or not doing. And so when we put that hope in ourselves, like, I'm going to believe in me, I'm going to do my work, so that if this person decides they want to do their work, well, I'm going to be ready because I'm already going to be doing my work. Or, you know, I'm just going to be doing my work because I need to heal through this betrayal. So really putting that hope in ourselves is what I've found in my work, that and my work is not just working with clients and getting, you know, responses back from them. I've done a few surveys that have several hundred people in them. And when people reported that they were hoping for others to return to the relationship, they acknowledged that, yes, they were still grieving and they were not moving forward. And so I began to realize that we've got to really be very focused on putting that work towards ourselves so that we can keep moving. And grief work, again, this is empowering, because when we know our grief and we're doing the right work, we are moving forward. So we're not staying stuck, which is really wonderful. So thus, when we are aware of our ambiguous grief, we can use our tools to move through the triggers so we can move forward. Okay, I just want to make sure that I got that last part. Okay, so original grief. Here's kind of the big stuff, meaning that what I've found in my work is basically every trigger that we have, every major issue, every addiction trigger. So I'm just going to use the same word. It really ties back to original grief. And there's actually some neuroscience research that is supportive of this, which maybe I'll talk about if I have time. So original grief is the perception or feeling of our earliest emotional wounding. That's kind of a vague definition maybe, but basically what that is it's the very small, quiet voice and feeling that we all have inside of us. I've not found one person that doesn't have some type of original grief. Someone can come from horrific trauma and abuse, or from seemingly a functional family, and there's always some kind of very small, quiet thought or feeling of, not being loved, not being important enough, not being safe. Again, not being important enough is really a common one, and we'll talk a little bit more about that. So it's the small, quiet voice that is certainly going to, occur after trauma, sexual or physical abuse, physical or emotional neglect. And for some, it is the perception of being unlovable or not good enough. And original grief is related to addiction, depression, anxiety, and other mental health issues. So when original grief gets triggered, addiction gets triggered. Addiction is often a way to attempt to not feel our original grief also. So let me finish this, and then I'll talk a little bit more about that. Excuse me. When original grief gets triggered, we do not show up in our relationships, and other areas of our life suffer because we are stuck back in our grief. So the way we think about getting triggered is, we don't just get triggered and then keep going along with our life in a healthy way. We get triggered and we kind of learn we get in a bad habit of reacting, and we're sort of operating as if we're stuck in our original grief. So whatever little quiet voice is in your head, my original grief sounds something like, no one has really ever loved me enough to stick with me forever. And so that's sort of rolling around like in different language and feelings when we're getting triggered. And so that's going to cause me to sort of react differently instead of respond in a healthy adult manner. But once we can learn to connect these dots of what our original grief is, we have the tools. That's the beginning first tool to be able to learn how to respond instead of react. But first we have to know that it's really connecting to our grief. That's really, really important. We must learn how to identify, feel, and process grief so we can continue moving forward. When we have deep grief awareness, we can better understand how much of our adult issues are connected back to our original grief. When we have recovery tools, grief awareness, and effective ways to move through triggers, we have power over our original grief and we truly move forward. So even though this original grief is still going to kind of bubble up at different points in our life, without knowing that that's what it's connecting back to in our brain, we would just sort of be going around in our life today thinking that, oh, well, that person's a jerk, or, blah, 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 this thing happened. And we're sort of just really seeing things just very much on the surface level, which is, I don't think that helpful. But being able to understand why I responded differently than the person next to me, that's because of my stuff. And my stuff is basically my original grief. So here's some strategies to process grief. Obviously 12-step programs, recovery programs of all kinds. I specifically like ACA because ACA does reparenting work and healing your inner vulnerable child. And so I think that's really, really helpful. And that's what I do a lot in my private practice, but I use something called Schema Therapy, which is research-based and it's very, very deep work. It's wonderful for all kinds of issues. And then ACA also talks about grief a lot. And so, they don't get as specific, obviously, as we're getting here, but, it doesn't matter. If you have this information and these tools, you can apply that to ACA work. So I think that ACA is definitely one of the smartest ways to work through grief. And also having a good sponsor in ACA is really helpful with that because they can help with the reparenting. And alternative therapies like somatic experiencing, EMDR, which everyone knows I love and adore. I find it to be, by far one of the quickest therapies out there. Brain spotting as well, yoga, breath work, massage, acupuncture, any practice that helps you feel safe and process. I mean, there's so many things out there that I haven't even mentioned. These are just the things that I am most aware of. And then psychotherapy, so deep therapy, not necessarily sort of like light, surface counseling work, not coaching, but, going to a therapist who really is comfortable, excuse me, who's really comfortable and knows how to access deep feelings. And not all therapists do that. Not all therapies do that. There's really not that many therapies out there that go very deep. And this is just part of interviewing people, finding out what their strengths are, and hopefully finding someone that can help you get to those deep, deep grief feelings. And then I want to talk for just a second about grief and the COVID-19 pandemic. You can actually read more about this in that article in the Wednesday Bulletin on ITR. So everyone is triggered at the same time during COVID. It's important to be aware of this when interacting with others. So, a lot of times in the meetings that I facilitate every Monday and Thursday, we talk a lot about how whatever interactions we're having with people today, they're triggered and we're triggered just because of COVID. Like, it doesn't matter what kind of argument we were having with them or anything else. Like, before we even get into that, or before we even have our feelings around what's happening, COVID has us constantly triggered, like 24/7. Even though we might not be, running around with our hair on fire triggered, we're still triggered because we know what's happening in our community, in the world, and we have to put a mask on all the time, and we're just sort of living sort of in this, sort of high alert place all the time. So we're always just a little bit charged, regardless of what's going on, and maybe you're feeling fine and you've gotten used to it, and that's awesome. But just the fact that COVID is a thing that we're still dealing with, it's going to leave everybody a little bit on guard differently. So to me, that means that we are all triggered 24/7, everyone around the world. Some people obviously more than others, but it's just something really helpful to remember. For me, it helps me just sort of settle down and give somebody a break, and just, not take everything so personally, because they're having a hard time too. I'm having a hard time. So it's kind of an easier way just to move on. Let's see. It's also important and helpful to be able to realize where our own triggers relate back to. Usually it's our original grief that is being triggered during a crisis. So what I have found with people is it's not just that we're all triggered, it's that we're actually triggered and it's connecting in our brain back to our original grief. For example, fear, terror, abandonment, neglect, that's gonna translate into, I'm not important to anyone. Why is no one checking on me? Why does nobody care about me? And also likely trauma is being triggered at this time as well. So ways we feel grief during the pandemic is traditional grief, like somebody's dying or they have died. So we've experienced death. Ambiguous grief, we feel grief about the loss of our way of life, loss of freedom, loss of connections, loss of a job. And original grief, all triggers lead back to our original grief, especially from the fear and uncertainty of the pandemic, as well as any other triggers occurring now will connect back to original grief. And then if you're interested, the last page of that PowerPoint has my contact information on it. I do a lot of grief intensives and workshops, and the workshops are online, and so you're welcome to contact me for that. I just started one this past week with ITR members, and so that one's full, but I'll probably start another one. If you're interested, please let me know. Just message me here on the website and I'll send you my email, and you can email me, and we'll start another one when this one's over. But the fees for my workshops for ITR members are literally a quarter of what I charge like everyone else in the world. So it's really, y'all are a lovely community that I really enjoy connecting with. And so hopefully if you think this is helpful and you want to get into it more deeply and figure out what your original grief is, then a workshop would be a great place for you. And you can actually take that work and do it in your 12-step groups and an ACA. So it's really helpful with that. There's my email. So if you want to email me, that would be better than messaging me here on the site. And I've got a podcast if you're interested in listening to that, Sex in the Bull City. I haven't done anything in a little while because I'm writing my grief book, but I'll probably, I'm going to start a grief podcast here pretty soon. And then on ITR every Thursday at noon is Codependency, Grief, and Relationships. Come talk to me then. And COVID-19 support group every Monday at 3 Eastern. So hopefully I'll see you there. And I'm happy to take questions or explain anything else in detail. Y'all just let me know.
We have questions. So for those of you that are joining, I am them to me. I'm going to ask them to Sophia. And if you run out of time, I've got about 12 things I want to ask you from the PowerPoints, but I'm going to ask everybody else's first. So first question. I experienced a lot of grief during my recovery. This somewhat strengthened my recovery, but I feel my personality is now distorted. I became very morbid, angry, sad, and negative. I may be stuck in grief, and I'm honestly tired of crying. I miss the person I was before the death of people I loved and the death of my relationships, my old life. I feel resentment, and I want to go back. How can I help myself? That feels very real.
Yeah, that's a big one. I think that, the first way that you've already helped yourself, I'm not sure what your name is, but is you have a lot of awareness. And awareness, I think, is, wow, I feel like that's like the hardest thing. I mean, some people are just more aware than others. And some people know they're not aware and they want to learn how to be aware. And that's a really great thing too. And I sort of call that being more conscious. So when we know that we're not really present all the time, we can learn how to be more present and how to be more conscious. And, you know, I think that one of the things that I'm hearing that would be really helpful would again be the Adult Children of Alcoholics and Dysfunctional Families program, because it deals with grief very nicely. Again, everything I'm hearing from you to me sounds like original grief is constantly being triggered. And when we don't know what our original grief is and how these daily triggers connect back to our original grief, then sort of we just look at this as, oh, well, this thing is happening in my life. And I do this too. At least I did this until I started coming up with this theory about grief. I was in a, very much a victimized place. Like that's sort of what that can feel like. And that's the script that can become a habit in our brains. And if you think about the brain is very simply a series of train tracks. That's all it is. It's neural pathways, it's train tracks. And so the train track that gets used the most is going to be the strongest train track. And so if our train tracks turn into this bad thing happened, and that person left me, and that person sued me, and this person hates me, we're going to all be depressed. And for sure, I mean, rightfully so. But when we can look at that instead and go, I think the reason why this breakup is affecting me so much is because it's connecting back to my experience of abandonment as a child, which leaves me thinking like, no, nobody really loves me. Nobody stays with me long enough to love me. So when we understand that, we can really separate it out and go, okay, I know what that is. And we can do reparenting and things like that to sort of soothe ourselves. But being able to separate these things out and know what needs to be tended to is really helpful, because otherwise, as we just heard, it can turn into like a mountain that we're trying to deal with, and that does turn into something called, it's either going to be depression or complicated grief, and then we're talking about having to pull in other resources. But I still think ultimately, having that understanding of original grief, it really provides a way to conceptualize our feelings in a way that's manageable and it makes sense. And it's not as nebulous as just general therapy can be on this whole big mass of things that we need help with. So I would say ACA is a good place, or get into one of my workshops if you want to kind of parse all that out and identify your original grief, so that all of that's going to make sense why those things are so upsetting. It's because your original grief is being felt as well, not just that one instance.
I appreciate that you said adult children of alcoholics and dysfunctional families, because, I always think, well, I would never qualify for ACA or whatever because I didn't have alcoholic parents. But I love that you said and dysfunctional families, because boy, that really opens the doors for lots of people and makes it a lot more inviting, I guess. So next question, and you've got a bunch. So here's the next one. Can you speak to grief that arises from trauma that we've suppressed so we don't have a memory of it, but our body reacts and triggers and feels unsafe? What is the best way to process these?
Yeah, I definitely can speak to that. I have original grief, even though I don't have trauma. I have no recollection of trauma. I do not believe I experienced trauma as a child, but wow, I must have experienced something, because I have a huge issue with abandonment. And so it is not necessary that our brain remembers everything. What's important is it's in our body. And if we have that little voice inside our head that's saying something unhelpful, and it's usually about something what I'm really finding, everyone's original grief sort of drills down to something of profound aloneness. And so I'm in the process of creating another definition of original grief, and going to have that copyrighted. But it's really profound aloneness. It doesn't matter how we get there, but knowing that maybe what that really just drills down to is just a sense of profound aloneness and isolation. Knowing that is all we really need to be able to process our grief. And our grief is actually below our trauma. So I like EMDR for both grief and trauma. And when I do EMDR, I do a lot of reparenting with EMDR because that really integrates it in the brain and the body.
So this is a perfect lead into the next question. Could Dr. Caudle address the relationship, if there is one, between grief and fear? This concept of grief is new to me, but I sense, at least for me, that various fears underlie my grief. Fear of being alone immediately comes to mind.
Love this question. And this is what some of the current neuroscience research is about. So when I started trying to figure this out, I was like, I've got to see, is there anything to back this up? And there is. And so the neural pathway in the brain called social bonding also encompasses grief, loneliness, fear, and anxiety, as well as addiction. And so that is the main neural pathway that we all are really working on strengthening and utilizing more frequently when we're in 12-step program. Because 12-step, I mean, the reason why 12-step works is because it basically teaches the brain to connect with other brains. And so, you know, how we have a sponsor and we have numbers to call and we have people to call and you know, all this, that, and the other. And yes, that's helpful to not use and not act out. But what it's actually doing more is it's strengthening that social bonding neural pathway in the brain. And when we have that really grooving and working and we're feeling good, well then, you know, we're not so pulled into addiction. We're not as depressed. We're not as anxious. We're definitely not as lonely. And we're not in touch with our grief and original grief as much. So that part of us is not being triggered as frequently either. It's not getting tapped into, because what's getting utilized in the brain is that social bonding neural pathway.
So the next question is, what are ways to help heal or what are ways to help inner child heal from abandonment and loss that have happened as an adult? How to dissect the difference between what the adult is grieving and how the child is grieving?
That's a good question. I've certainly experienced that myself. And so we still have to heal it in the same way. And what I do with myself and other people and clients is reparenting. And so that reparenting is something that is available through ACA, but it's also, again, it's in the work that I do, which is Schema Therapy, which is deep reparenting. It definitely changes the brain. And so we have to reparent ourselves as we're adults. No one else, you know, we are the only one left to do this work for ourselves. And even experiencing abandonment as an adult, which I have as well, it still taps into something that, you know, is in my little girl that is bigger than what I've experienced as an adult. So, you know, now I'm using myself as just an easy way to use an example, to have an example for y'all. But, you know, the feelings as an adult, for me to feel like I'm a small child as an adult, the only way that I could feel that would be if I experienced something like that as a small child. Like, it's not like I'm going to invent it at 45 and it's just going to happen. No. And we've all experienced something like that. I mean, I know that there are plenty of people on the planet that, you know, they have not had a technically traumatic childhood or life experience. But regardless, I have seen in my practice, trauma is relative. All of this is relative. So I have clients who have not experienced big T trauma, but they have experienced trauma in other ways, not feeling like they were loved enough by their parents after more kids were born after them. I mean, there are lots of ways that the small child brain perceives what's happening around him or her that can create trauma and original grief.
So I would invite you also, if you did not see Eddie Caparucci or Troy Love's videos, they're on the video link. Eddie Caparucci talks specifically about inner child, and Troy Love talked about attachment wounds, and both of those may be useful for you as well. So those would be in the videos where this one will also be. And then the next part of the question was, do you have a particular blog that you would recommend to those of us who can't see? Anybody who's trying to pop in the box, just remember I'm going to X you out. Do you have any particular blog articles you'd recommend to help those of us who can't seem to stop waiting 2 years later for someone to return to the relationship? How to shift from that focus on healing to self that feels meaningful enough?
Well, I would say go to my website, which is bullcitypsychotherapy.com. I've got some blogs there. I've got a podcast called Sex in the Bull City. So I would say, that would be helpful, because I'm the only, I haven't started training therapists yet per se in this work. So I originated this work. So it starts here. So you can also come into the meetings here on ITR and talk with me about it. You can see if you're appropriate to be in one of my workshops. I do women's love addiction workshops as well, which we get into grief. So there's lots of, I would say just email me and let's chat and see where you might fit. And I'll be happy to help you out and help you find a place to be. But that sounds to me like definitely ambiguous grief, but there may be some love addiction in there. Certainly anyone who, we all have some kind of deep original grief, but addicts definitely do. And when we talk about love addiction specifically, there's a lot of grief there that's from early childhood for sure.
The next question, can you explain more of the difference between ambiguous and complicated grief? They seem like the same thing.
Complicated grief is long-term grief that has really gotten stuck. And it's just, it's not been able to be moved through and processed and understood. And, it's like sometimes that's like trauma. When people experience trauma and they go to therapy, my experience is people can talk about trauma and until we're in the grave. I mean, we can talk about our trauma all day long, and that's not helpful at all. And so, we have to do other therapies like EMDR, which goes right to the limbic system where the trauma is stuck, and it immediately starts processing it through. So people feel better, like quickly. And complicated grief, I think, is probably grief that has maybe not been processed in a helpful way for that person. Ambiguous grief is the grief that we feel when we've experienced like the loss of a relationship and someone's still living. So they might be walking around our life and we see them and we're like, whoa, what happened to our relationship? Why is this the same person but acts totally different? And now we don't even talk. So that's more of what ambiguous grief is.
The next question, can the relationship between grief and depression be explained, and what are the treatment options?
Yes. So grief is people who are depressed are definitely tapping into their original grief. Grief is a feeling of like immense sadness, usually due to some kind of loss or some kind of awareness or perceived awareness, as in original grief. There are like diagnoses in the DSM for complicated grief. And so there's the way to deal with that. I think for me, sometimes people, depending on how long someone has really been in either of those states, medications are helpful. Going to a good psychiatrist is a good way to figure that out. Not going to a primary care physician. I mean, the way I think about that is if someone has more than one issue, so let's say addiction and depression, or addiction and complicated grief, or addiction and trauma, more than one issue, we need to be at the expert of the brain, which is the psychiatrist or the psychiatric nurse practitioner or the psychiatric PA, but someone who specializes in the brain and medication for mood issues.
Thank you. I could get on a rant on all that. So the next question, partner died, started drinking like hell after 7 years sober. Dog died 2 months ago, my only pal. Now I'm on a very bad downturn. What to do?
Oh, I'm so sorry that that happened. Like, so, it sounds like it all happened maybe near to each other, maybe even in COVID, which is really, really sad. I would say that, again, if y'all can remember that social bonding neural pathway in the brain, we all need to make sure that that is getting lots of traffic. Lots of train tracks need to be going over that social bonding neural pathway. So for me, that means getting on this website as often as possible, attending meetings in your area that maybe might be through Zoom, connecting with friends that are healthy, connecting with recovery partners, maybe even getting another pet. But, I think also doing some grief work. Again, I have a lot of people come in my workshops and they've just experienced the death of a loved one, but we still get into that original grief work, because the work we do in the workshops is we take whatever grief someone has actively going on today and we connect it back to original grief, and then we still do all the reparenting work around that. But when we can do all the work, even as far as back to original grief, it helps deeper, it helps more, and it provides an understanding also as to why we feel so charged with what's happening today. But I think, again, just getting support around you and really choosing to go into the grief. Grief is one of those areas of work. It's like fear. We have to go into it. We can't sidestep it, deal with it later. We can do that. I mean, I've certainly done that. I've waited like 15 years to deal with something that I didn't want to deal with, but wow, that was a really bad idea. I should have dealt with it 15 years ago. But it's really, we have to just go into it head on. If we're ready to do that, then that's really the most helpful thing, is to just accept. And that's what a lot of my clients are doing. That's what a lot of us are doing during COVID. It's like, hey, let's deal with some heavy stuff right now. Life has become less distracting. So let's really deal with some things that we don't have to put off anymore.
But you're also talking about doing it together and in groups and things like that. So to this person, lots of loss, but please, you're not alone. And the more you engage with these groups and other people, I think you will find levels of healing. So
yeah, and therapy. So like, we're still doing EMDR over Zoom, and so find a good therapist in your state and someone who can help you process through all this, for sure. All of those things, and EMDR will help you move quicker also.
Yes, I love EMDR. So,
Yeah.
Okay, next one. Do you feel depression is numbness which doesn't reach to grief, or is it grief, or both?
I think it's probably going to be different for every person. I know that I think if we're in a culture and society, and a lot of my colleagues, we don't deal with grief. And so when people come to us after, feeling depressed for 4 or 5 years or longer, I don't know that a lot of people make the connections of grief. So I would say, come and talk to me in one of the meetings and we'll try to figure it out. But it very well could be grief. And I definitely have found in my work that once we do the empowering work of finding out what the original grief is for each person, and we start doing specific work aimed toward that original grief, we really stop talking about depression. It's just not a thing anymore. And if it is a thing, then we know it's a thing, and then we take the steps to treat that. Again, it could be more different therapy, EMDR, medication, exercise, neurofeedback, mindfulness, all kinds of things. We have all kinds of tools to work with things like depression and anxiety. Absolutely.
So the next is more of a comment. It just says, thanks for your service. Anyone can find past summit speakers on YouTube under In the Rooms channel. This one comes up and it'll come up later. So thank you for sharing that. You're right. So thank you for some of you who joined later. This presentation videos and now the PowerPoints will also be added. So you'll be able to see those. And for those of you that joined later, if you didn't catch that already, you can download the PowerPoint. It's in the blue band at the top, The Power of Ambiguous and Original Grief. You can download that and it's got a lot of the resources too that Sophia is mentioning. So, okay, next question. Is there treatment that goes straight to the limbic system where complex PTSD is concerned?
Well, like EMDR goes right to the limbic system. And so did they mean, is there another one?
Well, I think they might have typed that before you said it, but I asked it anyway because I thought, well, I wonder if there's others too. Are there?
Brain spotting is another
Okay.
one. Yeah. Somatic experiencing, which I'm not trained in, I would say look into that. For me, I just know that EMDR is very quick. Brain spotting is very quick. Brain spotting is just an offshoot of EMDR, is all that is. And it's actually a lot easier than EMDR over Zoom, a whole lot easier. So at least I think that's my little old opinion. And so, yeah.
Yeah, I had an online with my therapist and she said, let's do a little EMDR. First of all, I didn't know I even needed it. Next thing I know, I'm doing EMDR and I'm crying. I've got tears flowing down my face and I'm thinking, so I do really love that it taps into stuff that even if you don't even know that it's there. So,
Yeah.
okay, here's a tricky question. Which came first, the loneliness or the grief? And if I am no longer feeling lonely, has grief left or is it just temporarily? How do I know my grieving is over? And off the subject, what does the statement, good grief, Charlie Brown mean? Oh, that's cute. Okay.
I'm a Snoopy fan from like early childhood. I think I've wondered that too. Like, and recently I'm like, what the heck was that about? What did she mean by that? What was that about? Yeah. So what came first, the grief or the loneliness? Grief creates loneliness. Loneliness taps into grief. And we usually only acknowledge, oh, I feel so lonely. I'm so alone. And so that's sort of where I'm coming up with another way to think about original grief, is that it's that profound sense and feeling of aloneness. It's constant aloneness and isolation. There were like 4 or 5 other questions there. I forgot what some of the other questions were.
It says, and if I'm no longer feeling lonely, has grief left or is that just temporary? And how do I know my grieving is over?
Those are good questions. So, I mean, my thinking, this is just my guess, my thinking, I think that we always have original grief, always. Whether we feel it all the time, I don't think that's going to happen. But I think that when we are doing certain things in our life that are healthy for us, when we have a good recovery plan and we're working our plan, we're connecting with people regularly, we're staying clean, not acting out, whatever, that might be. We're being productive, those kinds of things, then our original grief is not going to get triggered as often. So, but I think it's always there to get triggered. The way I think about it is it's always there. It could be lying dormant for a long time, but when something happens during the day, like someone insults us or someone cusses us out or they leave us in a relationship, it's going to really get triggered. So whatever the incident is going to feel more intense once it connects with this. But I think it's always there because it's part of our brain experience from a very early age. Usually original grief is like created and it's like formed between the ages of like 0 and 3, 0 and 5. So it can even be like pre-verbal.
Okay. I was thinking, when I'm more in the zone, when I'm congruent, I'm taking care of myself, I'm not, whatever, I think I have more bandwidth. Like I'm more able to understand, that's like, I can feel that that's going to an old wound and reparent the exact thing you're talking about reparenting. I can go, oh, that's that young Tammy, and I can reach back to her and let her know it's okay. I mean, all of those things. But I think, like you were talking about the collective COVID and like everything else. And, it just feels like the bandwidth has gotten smaller. So, it's more likely to get tripped up. So, okay.
Yeah.
Next question. I've been trying to find out about chronic post-traumatic stress disorder treatment for years now, but no one has mentioned how to find it or what it is. I know about somatics, but don't know specifics. So had to find out this information. So, and I haven't looked. Are there people that work specifically with chronic post-traumatic stress versus post-traumatic stress? I mean, what are your thoughts on that?
I don't know that that's even important. I mean, like in the way that we think about EMDR now is you don't even have to experience trauma. You know, we can do EMDR about addiction triggers, about anxiety, about depression, about grief. We can do so much with EMDR. So, you know, I don't know that I would worry about that word chronic. If I were you, I would just get myself to do some EMDR with somebody who's you know, thoughtful and who can look at all the layers of you individually. And that's really, and I also, you know, I don't pay a ton of attention to diagnoses, to be perfectly honest with you. Diagnoses are there for some people because it's important for medication purposes, but they're there because we need to file insurance for people so they can get reimbursed. I don't sit there and think about, oh, well, there's chronic this and that. It's just what's going on, you know, how can we help this person? And so, you know, that's one reason I like the grief lens, because it's not a diagnosis and it's not meant to be. We're looking at the origins of what we feel today. And what we feel today is how we get those diagnoses. But it's more helpful to me not to treat the symptoms, which is the surface, like that's a depression and anxiety, et cetera, but go down here and treat the foundation that creates all this. So that's sort of why I like just the lens of grief itself.
I talk about that all the time when people are reaching out to seeking integrity too, because, you know, like the addiction is a symptom. And we want to stop the behavior, but we absolutely want to address the underlying issues, because otherwise it's just pop, 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 pop to the next thing. So we are out of time. Thank you all for joining us. Thank you, Sophia. It was delightful to see you again. Thanks for all your great work. And I think I need to pop into your COVID grief group. So I'm actually gonna put that on my calendar. So hopefully I'll see you soon. So thanks everybody.
Thanks,
we'll be back
everybody.
in November.
Thank you. Bye, everybody. I appreciate it. Thanks for attending. Get in touch with me if you want to come to one of the meetings on ITR or to one of my workshops online. Just message me or email me and check out the PowerPoint. But I appreciate everyone being here. Thanks, Tammy.
Thank you. Bye-bye.
Bye.